Thank you, Dr. Quimby, and welcome back everyone from the break. I'm really excited and very honored to be here today, particularly to be a part of Team Renal Urinary in the afternoon. And as we finally make our way down to the bladder, no dismissal of the kidneys, don't worry. And I would like to thank the Purina Institute for inviting me here to speak today. Here's my financial disclosure slide. I don't have any disclosures that will result in any conflict with what I'll be speaking about this afternoon. So some of the topics for discussion. It was a very broad title I gave. So what I decided to focus in on is feline idiopathic, or you might have heard this referred as feline interstitial cystitis. And I'm just going to call that FIC during this talk. We're going to briefly look at the classifications of diseases, what that means in relation to this disease in particular, talk about bladder-centric type research, as well as the systemic approach to looking at this disease, particularly the effects of stress on FIC, how this results in inflammatory changes, and most importantly, utilizing this research and inflammation to how we can treat this and how this affects the outcome of our patients. We'll look at, again, then finally, very briefly at some novel areas of investigation. And this is a translational talk. We're going to look at various species that have interstitial cystitis, if you will, and one of the best models, too, humans. So I always think that humans are a great naturally occurring model for our feline patients. So as I said, I want to talk very briefly about the classification of diseases, which is nosology. And this is the medical science that deals with classification of diseases, and it requires knowing both the cause, the effects, or the symptoms of the disease. Now, how does this relate to, say, a disease like FIC? Well, if we look at symptoms and signs, we know these cats have, stranguria, plaquuria, hematuria. And you can see probably, many years ago, we talked about this disease and we called it feline lower urinary tract disease. Makes sense with the symptoms. What about the organs involved? Well, primarily we look at this, or originally we did. Hopefully I'll change your minds today if they haven't been already. This was very much a bladder disease. And while it is my very favorite organ, you can see the bladder is very affected by multiple different organ systems. And this happens in a lot of other diseases as well. And maybe we've had a little bit of a detriment in calling these types of disorders cystitis because it puts the focus there when maybe it should be a little bit broader. Finally, the pathogenesis. Well, obviously, it's not completely understood in this disease, and this schematic shows, and I'll review it a little bit later, kind of a lot of complex interactions between, say, the bladder lumen, which would be depicted here, as well as kind of the effects and how it works with C fibers, the sympathetic nervous system, and then transmission of pain symptoms up to the brain and higher processing centers. Well, FIC is one of the most common differential diagnoses for cats that present with lower urinary tract signs. And about anywhere from 1.5% to 4% of cats that present with lower urinary tract signs overall. And approximately 2/3 of those will be diagnosed with FIC. And as I mentioned, the cats can be as well a very naturally occurring model for this disease in humans. That name has been changed over time, and it's referred to now primarily as BPS, which is bladder pain syndrome. This occurs in approximately 2% to 6% of women and about 2% to 4% of men. And again, its initial focus has expanded just from the bladder to be a little more of a systemic disease as well. Knowing the risk factors for FIC can be very important, I think, because there are many different, precipitating, perpetuating, and predisposing factors for FIC, and knowing these might actually help us overall prevent the disease from occurring, which of course is our goal. There aren't many genetic studies in cats looking at FIC. There are some studies in humans. For example, I think there's a genetic polymorphism in chromosome 13q, And this has been found in humans, women primarily with panic disorder and BPS. We certainly have some overrepresentation of breeds. We still see this disease most commonly in like the Persians and the Himalayans. And there are familial associations, hereditary causes in humans that have been documented. Most cats with FIC are generally in the age range of maybe 1 to 8 or 9 years of age. If I see a cat presenting for the first time with lower urinary tract signs at age 9 or 10, other differentials are going to go higher on my list. In cats, it can be male or female as well, but the male cats are the ones who are obviously more likely to obstruct from the disease. Possible other risk factors, I think about problems maybe associated with the immune system, or did the bladder have a previous insult? This is a little different than humans because I have seen some cats present, say, with a stone in their past and then develop FIC. And I wonder always, did that cause maybe some urothelial damage? Did it prime the bladder to be more sensitive? But the one thing I think we'll focus more on are the things you see there in red. How does stress affect this disease? Things like early adverse life events. You see depicted there, that little kitten down there. This is one of many of the orphan kittens that we have a big project at UC Davis overseen by Dr. Karen Verneau does a lot of that work in caring for these kittens. And a lot of them, unfortunately, some of them are bottle raised. And in my experience, I have seen, purely anecdotal, some of these kittens present more so with lower urinary tract signs. And I always wonder if this is a form of an early adverse life event, and does that set them up as a risk factor for this disorder? But really, anything that might cause an increased threat that the cat perceives as a threat can increase what's called the central threat response system. And I'll talk more about that in subsequent slides. So unfortunately, there is no good diagnostic yet for FIC. It's still a diagnosis of exclusion, a negative urine culture, combined with the absence of abnormalities on the CBC and biochemistry panel, and no evidence of uroliths either on radiography plus or minus ultrasonography. And there's no actual definitive biomarker, even though a lot of them have been published. Nothing is used clinically as a diagnostic test, or unfortunately a bladder abnormality that says this is specific for FIC. Maybe that'll change someday as we're starting to get more into AI and machine-based learning. If we can start putting more data together, maybe we'll start to develop some patterns and gain more information on this. There are two main types of FIC. The classic form, which this is the one that's associated primarily with what's called Hunner's ulcers. And these are mucosal lesions that rupture when the bladder is distended during cystoscopy. So you can see in that bottom right, there's a picture of a rigid cystoscope. You introduce that into the bladder, distend usually to 80 centimeters of water pressure, and then you might see the bladder ooze and weep more with more deep ulcerations. This is not very common in cats or humans as much. Much more commonly, we see the non-ulcerative form. It's much more chronic, waxes and wanes, and this is the one that's most analogous to BPS in humans, which is what I'll focus on today. Many years ago, we scoped these cats all the time, and it was done primarily because the main lesion that was noted was something called a glomerulation. And these are little pinpoint petechial hemorrhages in the bladder. Just to orient you, this top picture here, that is a very healthy, normal mucosa. You can see the vessels out into the periphery. Down here in the second picture, these are little pinpoint glomerulations. And you might see too, you don't see the vessels as well right around there. It's not that it's out of focus, that's edema obscuring the vasculature. And again, the bottom picture is just a bladder that is extremely friable. Now, I mentioned glomerulations because of the fact that these were actually considered pathognomonic for FIC or interstitial cystitis in humans, and was a requirement to be present to diagnose the disease and utilized in a lot of clinical trials. But we've subsequently found out it's not pathognomonic. It can be seen in a variety of lower urinary tract disorders and in non-urological diseases as well. So I don't really think we need to scope them. Finally, the severity of the signs that we see don't correlate with the clinical signs that the cat's presenting for. So that doesn't really help us grade how impact the cat is. Some gross lesions here that you can see. Hemorrhage, probably the biggest feature. You can see an edematous bladder, and sometimes the bladders can become so thickened they become fibrotic. And I'll show you some studies we did on how that might impact, their voiding pattern. I have basically one histopath picture because we don't biopsy these cats anymore because, again, the lesions are, fairly subtle. You will see some submucosal edema most commonly. Occasionally, you'll see lymphoplasmacytic inflammation, more so in the classic form. Hemorrhage, of course. I'll talk a bit about mast cells, too. Rarely are neutrophils involved in this disease, and as I said, at the end it can become actually fibrotic. So what's the etiology for this inflammation? Well, we can talk about both a top-down approach or a bottom-up approach to the inflammation that we see. So I'm going to start first with the bottom-up approach. So in other words, what is impacting the urinary bladder to sensitize it, be angry enough, be so inflamed to then result in pain transmission and the clinical signs we see? Things like, did it have some sort of injury? I mentioned things about maybe a previous UTI or urolith. There's some research looking at the actual urinary microbiome and could that be altered. Nothing in BPS is coming out that strong in this area at this time. One thing that's been documented quite frequently in cats and humans with this disease is an altered urothelial permeability. And there are 3 layers to the uroepithelium. You have the basal layer here, the intermediate cell layer, and then the apical layer. And that apical cell layer, too, are referred to as umbrella cells because they have these cell surface proteins that, for example, things like uroplakins. And what happens when the bladder is filled and gets distended, those fuse into the cell surface proteins to allow the umbrella cells to stretch and become very, very wide to accommodate urine filling. But when they do that, they maintain their tight junctions between the different cells to keep permeability, to keep the permeability barrier. But cats with FIC, we have found that they have a very denuded uroepithelium. So when you look at these 2 pictures, this is a normal cat by EM, the umbrella cells seen here, and even when the bladder's distended, they're maintaining very good tight junctions, versus the picture on the right, that's an IC cat, and you can see a very denuded uroepithelium. It's even been reported that sometimes some of their intermediate cell layers are missing. They also have decreased glycosaminoglycan excretion, and the gag layer has been reported to coat those urothelial cells to, again, act as a protective barrier. So if it's missing, that might contribute to altered permeability and increased inflammation. Dr. Lori Berter at the University of Pittsburgh, she was one of my PhD advisors. She would always tell me, too, those little umbrella cells, too, they can act like little neurons. She would get super excited and say, some of these umbrella cells can act as little sensor cells to things like norepinephrine and acetylcholine. And they can be mediators. They can mediate themselves and release things like ATP, nitrous oxide, and cytokines. And what happens then is all of these inflammatory mediators begin to communicate with bladder nerves and the bladder muscle and also local inflammatory cells and recruit them. This then leads to that perpetuating bladder inflammation cycle. As I mentioned, mast cells have been associated with this disease, and mastocytosis has been reported in the uroepithelium in both cats and humans. And what's interesting is that mast cells are pretty much adjacent to the sensory fibers, those really highly sensitive C fibers. So it's thinking when these degranulate, they may perpetuate some of the pain that's seen in this disease. Furthermore, upregulation of substance P receptors, which in the bladder have been shown, and those also sit right next to the vasculature, contributing to vascular leakage. But also with mast cells being so close, the release of histamine augments this and perpetuates the inflammation. We've also noted in cats that some papers have been showing increased serum cytokines such as IL-12 and IL-18, and a variety of different cytokines have been shown to be increased in humans as well. Now, while targets for mast cell therapy have been developed and looked at, antihistamine's not the end-all be-all, and I think primarily the mastocytosis is likely a consequence of this disease, and unfortunately it's not really the cause. I mentioned that sometimes bladders can be quite thick in some of these cats. And what we have done, we did some urodynamic studies to evaluate if these cats had evidence of overactive bladder or what their bladder filling was like to try and document differences between healthy cats. And what we did is we anesthetized them, we inserted a urinary catheter, and then the cats were placed in lateral recumbency, and you slowly fill the bladder and you measure the pressure that results. And what we found is that the volume that we could instill was much less than a healthy cat at much higher pressure, suggesting too that their bladder compliance was a lot lower. And clearly, right, we see these cats, one pattern is they void small amounts of urine frequently, so that fits. Now, this could be due to the fact, as I mentioned, some of them had very non-compliant bladders due to fibrosis, but also the possibility of increased pain, so a lower pain threshold, due to, again, those increase in C fiber sensitization and recruitment, so the detrusor muscle is going to fire a little bit earlier. So that's just, again, a very small overview of some of the kind of bladder-centric research, which led to a lot of bladder-centric therapies. And one of the main one that was initially started in, I don't have my glasses on, I can't see what year this was published, I think it's the early 80s, came out in humans looking at giving a gag replacer, sodium pentoso polysulfate, to humans with interstitial cystitis. It was a non-placebo controlled trial, and they gave it to 24 women over anywhere from 6 to 12 months. And look at those results, right? Those are really good. They had about a decrease in symptoms by about 80% in 20 of 24 patients. And I'll get back to this as we look at this and what happened in cats and then subsequent what's happened in humans. There are also a lot of bladder-centric therapies we've developed in cats. That picture, just by the way there, you see the one on the right, this is a picture from a cat that actually presented to our dermatology service because there was hair loss and erythema. We have great dermatologists, and they took a really good history, and they said, hey, Jodi, I think this cat's having urinary diseases, and they referred it to medicine, and they were right. That's what the main issue was in this cat. So you can see this is a pretty painful disease. So I'll show you in the next slide how gag replacers have been used in cats. We've had some studies, we've looked at resiniferin toxin. Again, that can help kind of ablate the C fibers from firing. Bladder hydrodistension has been used. So if you distend the bladder and keep it at about 80 centimeters of water for a few minutes, the theory is you will degranulate all the mast cells at once and then allow more comfort afterwards. Other things like anti-inflammatory diets and drugs have been proposed. And in humans, there are some case reports and things looking at partial cystectomies to try to improve clinical signs. But largely overall, these are not effective, particularly in long-term studies. The signs continue to come back. So this study I'm showing you here, this is still an abstract. It is not published. But this was the study evaluating pentosan polysulfate in cats. And as you see on the y-axis there, that is the index of basically measuring their lower urinary tract signs. And on the x-axis is the time 0 and 6 months. And you see the 3 different lines there. They gave the cat the glycosaminoglycan replacement, and then you can see all 3 lines went down. Those are different dosages of the gag replacer, and one of those lines is a placebo. Okay, so all the cats did fabulous. And I make no money on this or anything either. I don't know if there's magic in pill pockets. I don't know what they did and how it worked. But honestly, we have to look at the placebo effect in our animals. And I took these terms. There's a nice paper looking at analgesic for cats with arthritis. And they talk about the caregiver placebo effect, right? And that's when we think, you know, we're always the proxy in some ways for our animals, but they just think the animals are doing better, and they have to self-report that. But there's also something called the placebo by proxy effect. And sometimes some owners, they feel, well, I really think I'm doing something fantastic for my cat, and so it might alter their interaction with the cat and how they are treating their cat, which maybe I'll talk about, that's a form of enrichment, and maybe also that actually helps the cat. And just to let you know, there was a fairly recent, larger placebo-controlled trial looking at gag replacers in humans. I think this one came out somewhere in Europe. I apologize, I don't remember. That one, they did not see a significant difference, too, in how humans responded to that gag replacer. So I know it's approved in humans, but again, long-term efficacy I don't think is there for most people. All right, so if bladder-centric things aren't working, what about a top-down approach? Things like conflict. We'll talk about environmental stressors, early adverse life events, and there's lots of papers, too, of course, looking at the gut microbiome axis. I don't have time to talk about all of that today, and we'll see if we can all collaborate with our gastroenterologist and the urinary specialist, and pretty soon there's an axis for everything anyway, as we figure, right, we come in as one being. We have to start addressing the global pictures of our pets. This one slide here summarizes a lot of different studies that were really spearheaded by Dr. Tony Buffington and a lot of his postdoctoral students and doctoral students, including like Dr. Haig, myself, and several others, Dr. Stella too, looking at changes that occurs in the central nervous system in these cats with FIC. And when looking, for example, in the brainstem, primarily an area called the locus ceruleus, this is an area that had large staining for tyrosine hydroxylase, which is the rate-limiting step to catecholamine synthesis. And what's also interesting is in that little area is where the Pontine micturition center is, so I always find that really fascinating. We've also documented increases in CSF catecholamines, desensitization of their alpha-2 adrenoceptors. Cats, too, have an increased CSF corticotropin releasing factor, but they have plenty of ACTH as well, and I'll show you later their cortisol response, though, is actually blunted. We've also, Dr. Haig showed in her paper, too, that cats have an increased startle response. So, right, they're more reactive to their environment, where think about like if a doorbell rings, right? What does your cat do? That? I saw a few people go like that. Some of them jerk and run away, where others might just go to the door and greet and say, hey, how are you? And so, again, a little bit paraphrased, but that's kind of what the startle response can measure. And this comes down to what we're finding in cats is that augmented central threat response system in the FIC. And it's the perception of threat that increases this. Again, maybe due to early events, but any threat, if it's sufficiently harsh enough as perceived by that cat, can trigger this. And just to give you an idea, I don't know if you all know what the stress studies that we did in cats, but it wasn't anything tortuous by any means. It's what we might do in a home. We moved the cats to a different room. They were in a different cage. We changed their food, and we changed their litter pan. That was the stress protocol. And what we found is a really heightened sympathetic nervous system and a blunted hypothalamic pituitary adrenal axis. And this increased reactivity to these stressors somehow sets up that increased inflammation and pathologic processes. So as you can see, to summarize here, you have some sort of perceived threat or chronic stress. This activates that central threat response system, the nervous system, the endocrine system, the immune system, leads to the inflammation, leads to all those lower urinary tract signs. That then, to me, that serves as an internal stressor, right? The cat doesn't feel well, sets you up for more threats, and the vicious cycle goes on. Moreover, in cats as well as humans, this disease is associated with a fair number of systemic comorbidities. Vomiting sometimes occurs and hairballs a lot in these cats. Hyporexia. We see increases in fearfulness and nervousness in some of these cats. I mentioned some of the neuroendocrine and some GI changes that occur. And also, cardiovascular abnormalities have been reported. So FIC, not just a bladder disease, right? The bladder comes in with the rest of the body. We're treating the whole patient, and it's really important this impacts me because I want to make sure I get this good, detailed history on other things that are going on in the cat. So what's really nice is I know we've talked a little, maybe in some ways we're behind human medicine and kidney pathology and some stuff. Here's where I think we've done pretty well sometimes. We're good veterinarians. And in humans, they now have a group, it's called the Multidisciplinary Approach to the Study of Chronic Pelvic Pain, MAP. And they suggest, too, BPS, not just a bladder disease. And despite the number of urological signs, they find that there is an increased risk for non-urological associated somatic syndromes. Things like anxiety, depression, IBS, migraine, even chronic fatigue syndrome. And so in humans, because they wanted to study this further, there have been a lot of different animal models to investigate this disease. And here's a review paper, and I'm also really glad I can't read the year, because this is the very first paper I ever wrote. And I know it's a really long time ago. And this one, of course, I did with Dr. Buffington because we were looking at animal models for FIC, proposing, we thought, hey, the cats might be a really nice naturally occurring model, but of course we looked at the other models that have been published. And when you look at some of the rodent studies in there, they were studying more the acute insult to the bladder and how that results in inflammation. But this didn't seem all that ideal to look at a model that is really a chronic disease. And we know that FIC is chronic and it's not localized to the bladder. So I found this talk, and I take no credit for this title. This is by, I think her name's Dr. Larissa Rodriguez, and she has a grand rounds online. It's on YouTube, I found it. And she titled it Stressing About the Bladder. It's a great title, I thought. And she's part of the MAP group, and they study neurovisceral interactions. Things like how does emotional stress, early life events, and both acute and chronic stress impact bladder pain syndrome. And they utilize models, though, that don't require a bladder insult because they're studying the effects of stress and anxiety. And looking at one of the models that they use what's called a water avoidance stress model. And these are little rats. They can swim, but what they do is they just put them on a little platform with water around them for a short period of time. That alone is enough to induce some of those rats to have increased voiding frequency and dysuria. And what's really interesting is the histopath can be really, really similar to humans with BPS. And because that's also similar to cats, I extrapolate it's very similar to cats with FIC. The mechanisms for this inflammation, though, are not clear. In this paper, this was one that, again, used that similar water avoidance stress model to look at bladder hyperalgesia. And what they found in this is that, again, using that, they had vascular congestion in the bladder, and an increase in urinary cytokines came about. Then they found that there was increased activation of the endothelin receptors. Now, these receptors are very potent vasoconstrictor peptides. And what happens is these receptors will sensitize the nerves and, again, maybe contribute to the painful feelings that humans perceive in this disease. And this enhanced afferent output contributes to the lower urinary tract signs that are present. Now, this, they propose, could be a target for therapy. And I thought that's great, right? We have to start learning about pathophys. But my brain went, well, what if we just improve the environment and we don't stress them? Would that also reverse the finding? I I ended up looking and I found this paper, and in this one, they looked at the influence of environmental enrichment after a stress protocol. And in these mice, what they used as their stress protocol was neonatal maternal separation. And again, think about some of our orphan kittens. That's why I related to this. So what they do is they'd separate the pup for maybe a short period of time during the day, and then they would produce similar signs to FIC. But what they found, and after that, they put them through environmental enrichment to see if they could reverse this. And to summarize their findings, that comes directly from the paper. And so environmental enrichment before adulthood. So if they did the enrichment either at puberty or pre-pubertal, the pups were able to completely revert and feel much better. If they waited to adulthood, it did not have the same positive impact. Now, maybe if they altered that enrichment, did a little bit more, it's possible. So I'm not going to say that just because you have a 5-year-old cat, don't do enrichment, okay? But I think that these were very interesting findings. So what about cats, okay? We know that chronic stress is associated with FIC in some of these diseases, in a lot of these cats. And this can also, we know that this leads to a variety of other types of comorbidities and sickness behaviors. But we know some of the risk factors, and we can alter them, okay? And this goes to what Dr. Buffington always states, and I use all the time. It's having that sensitive cat, right? The one that's hardwired, predisposed to the disease, and you put them into a provocative environment for them, boom, we trigger the inflammation and we have the signs. So how can we alter this? Well, one of the first things I think we have to do is we have to listen to our clients. And honestly, I think we're all pretty good at this, but sometimes we do get really rushed during the day and we might whip through some of these cases. And I wanted to kind of look at this, and I found this paper in Humans. In this paper, they looked at 57 women who had BPS, and all of them experienced some form of provider disbelief, right? They went into their doctor, and their doctors looked at them and said, well, you look fine. You don't seem painful now. Are you sure anything's wrong? Or they felt that they weren't being listened to, and they might have, I'm sorry, we know we get our clients who Google things, right? And sometimes we're like, oh my gosh, do I have to? But we do it too. I know I do it. I PubMed things before I go to the doctor. And they felt like, they said, hey, I found this, could this impact me? And they felt that they just weren't being heard. And because of this really negatively affected their outlook and their well-being. And the MAP group and the network said, hey, we need to go beyond the standard urological approach and look at them systemically. And I think doing this for our cats, we're doing a disservice if we don't. And I think a lot of us do, looking at good questionnaires in some of the more severe cases, taking detailed histories on their environment, what type of food they're eating, where they're feeding. And this brings me to multimodal environmental modifications, or memotherapy. And for me, at least, and I think a lot of people, this is kind of considered the standard of care at this point as a starting point for cats for FIC. And this, as you can imagine, this is a top-down approach to therapy. We're not bladder-centric here, we're brain-centric, if you will. What we're trying to do is shut down and decrease the central threat response system to decrease the inflammatory changes. Now, believe that a treatment that will actually increase the perception of control. Now, I'll be honest, not just control that the cat perceives, but maybe control that the owner perceives, right? If they feel they have a grip on what's going on in this disease, that will do nothing but empower them, and it will help decrease the perception of threat. This is more likely to be effective than treatments that don't do that. So the approach for memo, I've already said, we need to know the risk factors, intervene early if we can. Not all cats are going to require this 4-page questionnaire and intense memo. Some cats will get better regardless in a few days and might not relapse. That's fantastic. How we implement memo should likely be tailored then. I know sometimes I'm guilty of it, and I might just give them a handout and say, hey, here are some suggestions, and I don't do follow-up. Guess what? I bet some of those cats do okay. Some might require much more intense counseling, follow-up calls, see how things are going. And others, which is kind of what we did in the paper where we looked at this and published on its efficacy, almost were like mini support groups. You know, we would call back, see how things were going, check back in, make changes. All right, I'll talk to you in another week. So it was before we did a lot of Zoom. So I think that may be necessary in some of our cats. Some considerations for memo. I'm not a behaviorist, but, you know, and there's lots of experts in this room and online who can talk much better about a lot of this, but I think we need to look at things like, you know, space. Do cats have individual spaces in their own territory in their households? Play activity. I think we're all pretty good at making litter box recommendations, making sure there's adequate number, looking at different textures of the litter. I'll talk about food and water in the next 2 slides. And then also, of course, as I mentioned, addressing conflict, whether that be between 2 cats in the household, between cats in different species, including humans, and seeing how we might be able to help that, and also trying to provide a most consistent environment for them that doesn't change abruptly and trigger signs. So I do know this is a nutrition symposium, but is a dietary change often recommended for this disease? Honestly, not often, all right? But I think it's very important that we look and get detailed history on what other comorbidities are present. Is there a chronic enteropathy? Is the cat obese, right? And then we need to tailor dietary therapy for those as well, because again, these comorbidities can alter the outcome and signs of FIC. So we have to look at everything. High moisture diets, sure, you can use them. They might be beneficial. For some cats, they might perceive this as enrichment because it's a really cool treat to get canned food. The original thought was it dilutes the urine, which might decrease kind of those noxious stimulants in the urine and decrease some of the pain. It's never really been proven. What I usually go by is I want to make sure 2 things, to let the cat and let the owner express their preferences. Because let's face it, if owner really wants to feed canned food, great. Put it next to the dry food, let the cat choose what they want to. Nothing worse than getting force-fed something you really don't want to eat. One thing, though, that I really think we have to consider about food and water is not just what we're feeding, but how are we feeding it, right? You want to make sure that food is placed in a very safe area for all the cats in the household. Individual feeding stations, right? Don't put it next to the washer and dryer or utility room when the furnace kicks on. It's not a great place to dine. Making sure for some cats, this is my cat, this was Alice. Alice loved, she was an indoor-outdoor, so she had a really strong prey drive. She loved to toss, we tossed treats everywhere. And I saw that look, Dr. Quimby, I know this isn't food, but this cat was so strong prey drive. When her little fur tufts would come off, she batted them around the house and played with them for like 20 minutes and really tried to capture her own hair. That's the best picture I could get of her. But in Alice, it worked really well, too, to give her puzzle feeders and other types of things to enrich her environment. Also looking at preferences for water bowls, food bowls, looking at the different shapes and sizes. And if cats really like hydration supplements, those could also be considered. Finally, in the last few slides, I wanted to talk about just another area of investigation to consider on how we can study the effects of stress and inflammation. And this is something called the conserved transcriptional response to adversity. And what this is it uses, they looked at RNA profiling studies to evaluate humans after chronic stress. And what they did is they found a pattern of differences that were associated with immune cell gene expression profiles. So what they found was an upregulated gene transcription involved in inflammation and a downregulated gene transcription that was associated with type 1 interferon, as well as antibody production and antiviral production. So when you have a high CTRA, that's not really beneficial. That's pro-inflammatory. So using bioinformatic analyses, they studied the CTRA, and then they looked at what they think could cause that. And what they found with chronic stress, no surprise, increased signaling from the sympathetic nervous system, and actually a decreased signaling from the glucocorticoids. This leads to that increased CTRA. Now, surprisingly, this is actually what we found in cats, right? And it's also been that kind of increased sympathetic nervous system, low HPA axis has also been documented in, chronic fatigue syndrome and some fibromyalgia in humans. In addition to that, they've looked at sympathetic nervous system fiber activation actually within the bone marrow. And when that happens, that can increase production of myeloid lineage cells, primarily monocytes, which are again pro-inflammatory. So the CTRA represents one molecular mechanism that might help link chronic perception of threat, negative behavioral responses, obviously then increase inflammation, and negative health outcomes. And this has been studied and looked at, for example, in cancer research, chronic fatigue and depression in humans, and found that pro-inflammatory anti-interferon profiles in these populations. And in another paper that's cited at the bottom, they studied 22 women who had breast cancer. They were young women. They were in remission. And then what they did is they put them through a protocol where they were doing mindfulness and meditation. And in just 6 weeks, they could see a decrease in their CTRA. I thought that was pretty interesting and thought, well, what about cats? What about the CTRA in cats? Which, a little advertisement, not gonna lie. We have a trial that we're going to open hopefully within the next month. It's funded, IACUC's approved, we're just getting the questionnaires done, where we're going to be evaluating the CTRA in cats with FIC. So you will process the RNA, you do genome-wide mRNA profiling, and then bioinformatics. And we're going to do that both pre and post-memotherapy. Now, we're doing 2 controls because I also wanted to look at, well, how should we do memo? And I don't want to withhold therapy from a cat. So we're doing what we're calling a sham control and full memo. So in the sham control, we're giving clients a handout that says, hey, this is how you should do memo therapy. And then the other form of memo will be more that kind of support group, if you will. We'll have some scheduled Zoom calls, recheck, see how things are going. So we'll see if there's a difference in outcome between the groups. If they're both positive, great. Are there differences in the groups? We'll also be looking at some litter box habits and outcomes and what happens in their activity in the litter, as well as client questionnaires. I want to know, too, if we give them a handout, what did they actually do? What did they implement? So we can kind of see how that's going. So if you're in the Northern California area, you have a cat with chronic lower urinary tract signs, my email's on there. Please feel free to reach out. So to summarize this talk, I think FIC, hopefully we're all convinced, I think the top-down approach for the inflammation that's seen in this disease is likely most plausible for what causes the visceral pain. I think we're well beyond the bladder. Knowledge of both predisposing risk factors can be important, and I think early intervention is key in possibly preventing the disease. I think memotherapy should be tailored to the individual cat and the owner, allowing both to express their preferences. Dietary preferences and comorbidities should both be addressed in the cat. And again, looking more at a patient-centered approach, using all the tools we have in our resources to help these animals. And with that, I'm happy to take any questions or comments you have.